So you know you don't need antibiotics for your cold, but what can you do to treat your cold symptoms at home? That's the topic on today's episode of The Physician Gardener. I am Dr. Kashidi Long, your board certified lifestyle medicine and internal medicine physician. Please hit that subscribe button and let's watch the video, or let's get into the video. So, number one, what can you do for your cold at home? Number one, you want to stay hydrated. That is one of the most important things to do, so that you can have enough fluids in your body to keep your mucus. If you're making any mucus, you want the secretions to be thin, and being hydrated keeps them thin. You want to support your blood pressure and your immune system by having lots of fluids, because you need to circulate everything in your body, so that it gets where it needs to go. Also, if you are feeling feverish or having sweats, then you're losing a lot of fluid. And so staying hydrated is very important to replace the fluids that you've lost. If you're having any vomiting or diarrhea, you're losing even more fluids. So trying to drink more than your normal amount of fluid when you are sick is very important. You can get these fluids by drinking water, Gatorade, teas like echinacea, elderberry, thyme, chamomile, mint, and green teas are all very good for you, have anti-inflammatory and antiviral properties to them. And then you could also make your own tea. That's a mixture of like ginger, a squirt of lemon, and some honey. And that would also be very beneficial, to help you stay hydrated and to get some extra antiviral properties. Number two, if you are having a lot of runny nose or nasal congestion, you can do a nasal spray or nasal sinus rinse. So nasal sprays, they have decongestant nasal sprays, and those active ingredients would be like phenylephrine or oxymetazoline. There's more natural ones like nasal saline, and you just squirt those in your nose, jot, jot. There you go. You can also use nasal steroids like Nasonex, Flonase, Nasacort. If you have a lot of swelling in your nose, those can be very beneficial in decreasing the swelling with just topical management. Another thing that we really encourage people to do is nasal sinus rinses. One of the most common ones is called a neti pot. There's other ones like the Neomed sinus rinse. These are available over the counter at most drugstores, and basically it uses a salt water mixture. They usually have the mixture that comes with the purchase of the little pot or bottle or whatever the squeezy device is. And you mix that with distilled or other purified water, not regular tap water. And basically you'll pour it in one nostril and it'll scoop out all the mucus and have it come out the other nostril. It sounds fairly gross, but it is highly effective. Another thing that can help open up your nasal passages would be to use a humidifier or a hot shower if you don't have a humidifier. Humidifiers, a lot of times when you're sick, your nasal passages will get dry, especially if you're using decongestants or antihistamines. And dry nasal passages can lead to you feeling even more stuffed up, or if you're having a lot of sneezing, that can cause nosebleeds. So using a humidifier can help improve the airflow in your nose and in your sinuses. And if you don't have a humidifier, 10 to 15 minutes in a hot shower should get you enough steam to open your passageways back up as well. Number four, most cough medicines, the evidence for how effective they are is, as the young kids say, it's mid. Like there's not really good evidence for like dextromethorphan and guaifenesin. It's something, and some people, if they feel it helps them, but it's kind of, some studies say it works, some studies don't. But one of the cough treatments that has been shown to be effective and has been used worldwide for probably hundreds or thousands of years is honey. Honey is a natural antitussive, meaning anti-cough medicine. It also has antimicrobial properties. So a teaspoon of honey every 4 to 6 hours or so can help you with your cough. You can also do the teaspoon of honey in like hot water. If you don't want to just take it straight, you put it in some hot water. You can add a squeeze of lemon and drink it like that. And that can help you with your cough and your hydration. So that is a very good option if you're having a lot of coughing and you need something to soothe your throat, help decrease your cough, and help keep you hydrated. Number 5, if you are having a lot of sore throat, gargling with warm salt water can be very soothing. So you can do that every few hours. You can also use over the counter lozenges and do the honey and warm tea, like I mentioned. In addition to gargling with salt water, you can drink other warm beverages such as teas, as mentioned earlier, broth, or soup. Those can just be very soothing with the warming sensation in the throat. Number 6, you can use over the counter decongestants and antihistamines. The combination of a decongestant and an antihistamine has been found to be more effective than either of those two alone. And so just look at the ingredients on the back of the package, or usually it'll say on the front if it has an antihistamine and a decongestant. If you have any medical conditions, sometimes certain decongestants are not good for you, so you need to discuss with your doctor which one you should take. But overall, most over-the-counter meds are considered fairly safe. And number 7, if you are having a lot of body aches or headaches or fevers, you can treat that with Tylenol or NSAIDs, which are your nonsteroidal anti-inflammatories, such as ibuprofen, Aleve, naproxen, Motrin. All of those things are basically the same. The caveat with Tylenol and ibuprofen: for Tylenol, if you have a history of liver disease, you probably shouldn't take Tylenol. For the ibuprofen and other NSAIDs, if you have a history of kidney disease or gastric ulcers, you probably should not take those. For an adult, which are the people that I see, the max dose of Tylenol is 3,000 milligrams a day. The max dose of ibuprofen is 2,400 milligrams a day, also known as 800 milligrams every 8 hours. The Tylenol, you can take 1,000 milligrams every 8 hours. You have to be careful with Tylenol because the base ingredient for Tylenol is acetaminophen. And if you're taking plain Tylenol and then you're also taking a lot of the cold and flu medicines, a lot of those already have acetaminophen in them. So you need to use that in your calculations of staying under the max dose of Tylenol per day, because you don't want to kill your liver, right? So those are the top 7 things you can do to treat your cold or upper respiratory infection at home. Let me know in the comments if you have any questions or if there's other at-home treatments you want me to review. Don't forget to subscribe, and thank you for watching. I'll see you next week.